we've been asked for a very difficult task, but yes, we will be able to pull. So yeah, we will be taking up, I would ask the estimate panelists here, delegates here, to introduce themselves in 1 minute. And also would like to throw up first question is, what is the meaning of sustainability for them, and what is that their organization is doing in this regard? So over to you.
Hello, good evening. Of course, post-lunch. My name is Bruno. I represent Burjeel Holdings. We are a listed company in the United Arab Emirates in Abu Dhabi, as well as we started in 2007. Sustainability, of course, as a listed company, we have certain norms to follow, regulatory norms, very strict ones. And for us, we look at sustainability in various angles. Because the UAE is more on health insurance. It is funded 90% by health insurance. So we have to see that we are sustainable, we are affordable, we are accessible. Along all these areas, we follow technology, we follow energy savings, we follow guidelines, especially to take care of our patients also without compromising. So I'll give it, that's all, and we'll dwell in further.
Hi, just to introduce myself, you can call me Katie Lim. So I'm representing Satacom Health. It's actually a charity. We provide medical services in 12 centers to the elderly people and the underprivileged. So the question for us is whether you want to centralize or decentralize. In Singapore, I can mention that, for those of you who know, Singapore is a very crowded place. So we cannot continue to build nursing homes. So that would be a centralized approach. So from the SATA point of view, we also do exploit technology. I was glad to hear telemedication. We're also exploring. And also we are actually exploring to expand our home nursing care, because one of the strategies is we want the elderly folks to age at home in their community. So that's a new wave, new thinking. And it's not going to be easy, because we started home nursing care. We also started doctors on wheels. Doctors actually visit the nursing homes and they go out. So we practice a hybrid. We still have the in situ medical centers where they come for outpatient treatment. But we also do go out to those, our beneficiaries who cannot travel to come and see us. All right, so I leave you some interesting ideas to think about.
Okay. Hi, my name is Nagaraju. Basically, I have more than 10 years of experience with pharmaceutical marketing. My core strength is I am a pharmacist by qualification, and also I'm working as a marketing head. So being a pharmacist, we mainly focus on improving the healthcare of the people. Okay. Presently, I'm working in West Africa, where we majorly focus on quality products at affordable price, and we are making sure that these products are available everywhere. If you see the topic that rising the bar for sustainable healthcare, here what we are doing as an organization is we are making awareness on various health conditions, like chronic conditions, where we increase the awareness for cardiovascular conditions or maybe diabetic condition, where people come forward and take treatment. And also we are associated with various organizations like World Health Organization, and also country regulatory body, where we are raising awareness on various conditions. Thank you.
Thank you so much. So thank you so much for having me here today. I'm Dr. Shilpa Desai, C4 Lifestyle and Diagnostic. I'm a founder, and we are into service product, and we are a tech company also. So when we are talking about the sustainability and raising the bar, I think it's all about the affordability. It's all about doing a we work, raising the bar of working together and giving a quality of healthcare, because we have a lot to do, and definitely it's not possible without coming together. So sustainability, wellness, affordability, and definitely a business comes together. So when we work together, this all 4 pillars can come together. So I think we are here for today to create the pillars of the sustainability.
Wonderful.
you
So we have here the panelists from all over the world, from UAE, from Singapore and Ghana. So, we are really looking for that the sustainability in healthcare is a common thread. And when we talk about the mental well-being since morning, it is quite possible, and it is very closely related with the physical health, and that's where we are here to discuss. So first question to you, doctor, like you tell me about when you are offering so many beds, so many hospitals, so what are the measures which hospital can adopt to become a sustainable or to adopt a sustainable in near future?
As I mentioned earlier, UAE is funded by health insurance. There is a system called DRG, disease-related groupings. That means if you get admitted, you have a fixed amount which you have to pay. So we have to see that to become for our patients to sustain, even for them to afford, we have to see that the cost is at the minimum so that they can get the maximum benefit out of their insurance claims. So for that, we as an organization, we have many areas. One is technology. As rightly mentioned, telemedicine is something. We are going into the homes, so our ICU cost is low, so we make ICUs at home for the patients. We have started green buildings. We have started saving on energy. We have started saving on, I think so it must be practiced a lot in India, energy saving, like your HVAC systems, your RFIDs, radio frequency IDs, when the movement of patients are going up and down, your electronic health records, the electronic health records are connected to the appointment schemes, they are connected to informed consent. I heard Captain Sandhya saying also about consents. So we have made it informed consent so that this informed consent go into the electronic medical record and get archived, because most of the medical legal conditions which I have faced in my career is when the informed consents are not read, there's no witness and there's no signature. And as one might find out that when there's a medical legal, you want to go and find out the informed consent, it is not there. So electronic medical, so technology plays a big chunk in nowadays to manage cost. And this is where we are also getting kiosks to make it sustainable for lower rung of blue collar workers. They cannot afford higher cost. So what we have done, we go to their camps, we have created kiosks for them, electronic kiosks. So you don't know, there's a telemedicine, they get a blood pressure checked, there's a nurse sitting over there, and she goes around from camp to camp, and she sends all the data back to the hospital, and only those patients which needs attention are called for. Thank you.
Excellent. So following up with this same question from Bruno, I'll go to Lim. So specifically when we are talking about giving an healthcare accessibility even to remote areas and in a home health aid setups. So my question to you is, how do you ensure the quality of healthcare is matched?
That's a challenge for me. We need to have very experienced nurses and doctors who are willing to brave the rain and the sun, and when they travel out to outside the comfort of their air-conditioned clinics. There are such people, but it's very hard to find. These are people who are very dedicated. During office hours, each day they take about 8 patients across Singapore. But it doesn't stop there, because if the patient calls you at midnight for help, would you go? So we need people who are willing to say, "Oh, Katie, can I claim overtime?" No. This is beyond that. It's something, a passion, that they work 7 days a week, and they are willing to go. So we are very proud of them. I'll say we're blessed to have these people. At the same time, I think one of the strategies that we adopt, at least from the Singapore point of view, we believe prevention is better than cure, because once you get a chronic hit, it's very expensive. So we want to do detection first. But let me tell you, it's not an easy journey, because most of the elderly people, they don't want to know. Say, I'm healthy. Don't make me go through all the various tests, and I want to live a long life. That's their tough decision that we are not the expert. Okay, we need the social workers to convince them that, hey, it's good for you. You don't want to be a financial burden to your next generation, right? to incur if you incur a major medical. Yeah.
So yeah, coming from where what Lim is saying, you know, definitely prevention is a key to one of the area making healthcare sustainable. So I'll go to Nagaraju, since you said that you are working in the area of prevention, specifically for the non-communicable disease. So is there any specific reason you have opted for these diseases in your region, or you would be interested to do prevention in, you know, all the areas?
Okay. Hello. Okay. Regarding this non-communicable diseases, generally in Africa, the prevalence of these conditions are more. So based on the statistics, we are focusing on particular condition where we can raise awareness. If I take an example of hypertension, in that particular country where I'm based, it is around 40 to 50% is undiagnosed. So you can imagine. And also diabetes, it is around 7 to 8% people undiagnosed because of the various lifestyle conditions they are developing. So that's why we are mainly focusing on to increase the awareness. So we have associated with the various regulatory bodies like Cardiovascular Association of Ghana, where we are raising awareness through them. And also we are educating the primary doctors, because in Africa what primary healthcare is a important means first point of contact. They don't have any specialists, so we do train them through various programs like master class we do, so that they can diagnose and they can send it to the professionals where the specialists can treat this condition. So these are the various initiatives. And also I can give one example. When I was in India, I was working on tuberculosis awareness. Okay, we in Dharavi area, it is well known in Mumbai, where the prevalence is very high and the hygienic condition is not that good. So we have collaborated with this organization, and we have spent some money to raise awareness so that we can decrease the cases of this condition.
Excellent. So picking up the point from Nagaraju, I'll go to Shilpa, because she's been one who has been working with 10, villages which has been adopted. So what I would like to understand from you, Shilpa, is how the physicians who are working, or how the primary healthcare centers who are working in these villages, they can be the people who can be, changer, bringing the sustainability even in the rural part of the country.
Yeah, Nidhi, this is an amazing question you have asked me. So definitely here, I think the youth who are sitting there, I really would like to address them and involve them in this talk. Because when we are talking, I feel that you must be feeling that what is this all about sustainability and wellness. But dears, this is all for you, a youth, who is going to take further a healthcare system, because you are the most challenging, you are the people who are going to face the most challenges in healthcare and the sustainability. So if you understand this, and village which I have taken, my project is Sarve Bhavantu Sukhin, a Saukya clinics. It's a telemedicine model where we have more than 800 doctors on board, and in that I have taken the Gujarat government skill development committee also in that, because the children who are 12th pass and then they do some short courses to just do a telemedicine, because telemedicine model which can be taken care by the certified people, and then they're taken care by the doctors. So when we take a one clinic, 10 village, the 10 village has a children, women's, man's, and the geriatrics. There we can run a certain program through the CSR, through the NGOs, through the Rotaries, through the Lions. So, and then we connect to the education industry there, where this youth come in the village and they do their project. So what happened? By the village, for the people, by the people. And that is, I feel, is the mantra of the sustainability and healthcare and growing together. It's ultimately this kind of model. Okay, I'll just tell you, we are going towards, by 2030, 100 clinics, 10,000 village, and 5 million people. And we are moving towards there. So this is something where I always believe a lone person can die and together we can live. It's not about us or it's not about I, it's all about we. We all healthcare industry experts over here. I really would like to say that each one of us can make a lot of difference, and all the people who are there, they are really looking forward to us. They are confused. They don't know what is wellness about. They don't know what is prevention is all about. Believe me, we struggle when we talk about the prevention. ठीक ही तो है, क्या हो गया है? ठीक ही तो है, डायबिटीज, ओके ठीक है, मतलब हो जाएगा. थायराइड आया है, ठीक है, मतलब you know we are getting so adjustable with that ठीक है kind of attitude. It's okay. It's okay. Now when the cancer is there in front of us, now we are dealing towards, oh, cancer hai. Now we are talking new. And you know, the 50 years back, diabetes hai. Now diabetes is common. So are we expecting that apna youth ye bole cancer hai? It's common. I think no, that's not we are looking for. We all are here and working hard. And I have really listened to some of you today. And I feel we all are working. And honestly, together, come together on a platform, be a part of this kind of project. And like the hospitals, every 10 clinic, we are having one hospital. So the private hospital and the government hospital, we are collaborating with it. And this is how we are moving forward. It's a successful model, I feel so, because the people are doing it. It's not we are doing it.
Certainly. So collaboration is a key. And
Absolutely.
I'm glad. So the collaboration is the key what we look for. But now my next question is to Bruno. Is, you know, when we talk about the telemedicine, what do you see? I mean, how we can take this more, and what are the challenges in implementing this to make the healthcare accessible even in the, you know, last milestone of any country?
So to make telemedicine successful, just now I was sitting down during the lunch break and I read the ENY report in the Middle East. So there is a $565 million of outlook on telemedicine. And it is top-down approach. I was hearing it is always top-down approach. So the government has to be very much involved in telemedicine, because the platform which they have to give should be secure, because it is on the internet, and there are a lot of misfits are coming into the system to and access data. So telemedicine, it has to come from the regulatory body. So where I come from, Middle East, of course, I was 4 years in India, 26 years back, but the regulatory bodies, there is telecommunication and digital regulatory body is an authority which is specialized and dedicated to telemedicine. So that is the way forward. If at all it has to come from top down.
Oh, excellent. So certainly something coming from top to down is, you know, high chances of getting successful. So I do agree with what Bruno is saying. So definitely now my next question is to Liam. When you say that, you know, your organization is also looking for financial burden, reducing the financial burden of the people who need health care, you know. So I would like to understand, besides the health insurance, which definitely is one of the criteria or area which Bruno has pointed out. So definitely one area for us is to improve the health insurance penetration in India. But besides that, what can be done to reduce the financial burden for the people who are suffering?
I think one of the things is using generic drugs versus the branded drugs. So we always look for things to save money. I mean, that's, as charity, we actually rely on the donations for people. So we have to be very, I would say, cost-saving savvy without compromising the quality. So buying generic drugs, and also we try to get funding. The Singapore government do provide funding for initiatives like what we do for elder care and, you know, for healthy screening. So we are very good, you know, to a point that, you know, HR, sometimes we raise funds. I've never heard HR raising funds, but this is the first time in this sector. I have to raise funds. We subsidize the payroll for our nurses and doctors as well when they engage on such community projects. So one of the things that you can help is really generic drugs. The other one, of course, I agree, Bruno, telemedicine is another way to save money. So I am blessed. I have one doctor based in Bangalore supporting us in Singapore. You know, in Singapore, the pay is very high, but he said, hey, I'm going home, but I still like to stay with SATA. So we negotiated him to be on a local pay, but he still supports us very well. So the world of healthcare services, I think telemedicine is going to change a lot of things.
Oh, great, excellent. So now I'll go to Nagaraju. So you said you are from a pharma company. Pharma company and going for advocacy program and for disease prevention. Doesn't it sound contradictory? How would you do the business?
Okay. See, as a pharmaceutical company and as a pharmacist, okay, we generally see giving affordable medicine is the priority. What my company is doing, we believe in affordable medication. So what our company is doing, as compared to other companies, that end-to-end supply chain. So starting from manufacturing, sourcing the API to the end customer, we have our own supply chain. So with this, we are providing affordable medication to the patient. I can give you few examples in Africa, what is happening. Africa is majorly influenced by Western countries, okay? So they want their medicine, which is costlier, and innovator brands. I can say some of the innovator brands, it is 10 times costlier than generic branded things. So we as a African company, we introduce this generic branded medication where we provide affordable as compared to other companies. I can give you one example. We have in our country a Novartis brand called Coartem. It is an anti-malarial. It costs 100 local currency, that is Ghana cedis. We sell our medication for 6 Ghana cedis. So you can see the difference of costing. Even though innovator brand is maybe 100% pure, means efficacy, ours is 99.9, but it matters a lot for African population. So with this way, we are delivering affordable medication with awareness on the prevention.
Very nice example. So what I'm understanding is they are taking an advocacy, just rather than going a plain marketing, they are doing a dual edge marketing where they has a dual impact. One is certainly that they are selling their brand. The second is certainly they are creating some key takeaways for the people whom they are targeting. So really certainly a very interesting factor. Now I'll go to the Dr. Shilpa. Dr. Shilpa, what I would like to understand is collaboration is the key, what you said. How would you keep people motivated and involved with the same accountability in the goal what you have set for getting the sustainability in healthcare and healthcare accessible for all?
Okay, so I really would like to say, Mr. Who is from Ghana, Nagarajan sir, that I'll start from you. India is now into generic medicine, right? We are doing a good in there. Would you like to import from us? Would you like to take from us?
So collaboration started on the
Collaboration
panel.
started here. So
No, our medicines, most of the medicines are imported from India only.
exactly. Okay.
APIs we procure from China.
That's all. So see, here I'm definitely representing India, and I really would like to see that how we Indians are also progressing, and we say that in the platform that we are taking Indian medicines and we are using the Indian pharma companies, very reliable and result-oriented and affordable medicines, and so Africa and other countries, UNICEF and other level of people can buy medicine from us. So yeah, when you ask me that how you motivated, yeah, we do motivate like this. We say them, we show them a business. We tell them that, see, from where you will do it. So it's like, if I ask you that 1 rupee from everyone, if we are 2.2 billion people, and 1 rupee, it's 2.2 billion, right? So it's all about the volume. It's all about the people. I always feel that how come it is unaffordable? It has to be affordable. Insurance company can take care of it in many, many ways. We are already working on it. We are trying to collaborate in these village projects with the insurance. Definitely Ayushman Bharat is also one of the things which is a very good thing has happened with them. But, it's not about the underprivileged people. It's about all of us. I always feel that why we are taking down only talking about when it comes affordable to underprivileged, it's for all of us. because you know, our emotional, our physical, our economical, everything gets off when somebody is sick in our house. So
So when you say affordable, I would replace it with sustainable. So as far as healthcares are concerned, we cannot differentiate between patients.
Exactly.
A patient is a patient. We always treat them as I would treat my own relative. So I would replace it with sustainable, not affordable. It has to be sustainable for all of us. And by the way, taking generic, we take it from India, because
Great.
the whole management is from India.
so that's nice, really. I'm always, whenever I'm like in US or I'm in Europe, I always see to it that we are talking about the India, because honestly, like right now, I was into, as a longevity expert, I work for the projects. So I was VO IPL COVID officer in 2020, and I've created the entire sustainable model for the players there. And then we work for the SRPF, Maharashtra State Police. Again, see, if you see, we have worked for the IPL, we are working for the SRPF in the villages. So these are the government models where we work, but it's all reaching to the general population.
Oh, but yes, when it comes from up to down, it's easy to success. So that is what we understood.
Exactly.
But my question to any one of you, even Bruno or even Lim, my question to you is, if it is not from up to down, and you have to start from amongst us, how would you motivate the people to get involved and to make it sustainable?
Sure. I think just want to share, I think for those of you who are in the clinical profession and you know that we talk about sustainability, now once you hit one of the major chronic disease, like diabetic, cholesterol or blood pressure, you're going to take the medication for life, right? So that is sustainability as well, not the one-time hospitalization, you go for surgery. That one is not my problem. My worry is really for those people. I was surprised to hear that people didn't know about diabetics, but you know, for those of you who know, diabetics can lead to kidney failure, which is even more painful, right? So if they don't fix the diabetic at the beginning, it gets worse, all right? Just for any consolation, you know, I'm on cholesterol, long for life, all right, and it's made in India.
I would add over to that is, we say about the stakeholder system, as you rightly mentioned, if it is not from top down, how would you make people aware? So I feel people should be made aware and educate them. And a new concept has come. Before there were shareholders and there was employers and there was employees, not anymore. Now these are stakeholders. Each and every one of us is having a stake in the organization, in the system, in the government, in every part of our lives. We are all involved. It's no more that, no, it is from the CEO, or it is from the CEO, or it is from the HR. No, each and every one of us are having a stake in wherever we work, wherever, in our homes. Husbands, for that matter. Everyone has a stake. You can't say that, no, the children's, oh, you take care. Nothing like that. Everyone is having a stake. So it doesn't matter. Yes, government is having a stake, but we also as employees, or we also as leaders, we have a stake. So stakeholder concept has to be prevalent everywhere.
Okay. I would like to add, I have seen one difference between India and Africa, or specific to that country. In India, as a pharmacist, okay, we don't have a community pharmacies, or we have a pharmacy shops, but their pharmacist doesn't sit. Okay, in case pharmacist sit also, he doesn't educate the patient. Okay, in India. Okay. In Ghana specifically, pharmacist has an equal role of doctor. Okay, whenever patient go to the pharmacy, he diagnose the patient with maybe they are having a nurses who can check the blood sugar or blood pressure or maybe hemoglobin level, and with the help of this nurse, pharmacist recommend the medication also. This change, Miss, we need to bring into India, Miss. It will help us to make sustainable health.
Oh, certainly. So this is pointing out to a recently, one of the model which has been put forward and is under study by the Edinburgh University, which is it's called shift role model. So it means like wherever we have the people, those can be trained to address the basic healthcare system or the basic healthcare diagnosis. How we can use the people who are there rather than we taking everywhere, each corner, the hospital or a clinic for that matter, which could be very costly. So yeah, this is certainly pointing out to what he is saying, and for that we need a lot of people who could be skilled, trained, and again then it comes a specialized versus a generic. So it's like, whether we should go to the specialized physician or to the general physician. So so this could be again a dilemma, but yes, where people don't have the specialized surgeon or the doctors, they should have a general physician or a primary healthcare center who can help them to, properly get screened and properly get channelized. So certainly we'll come to that. Now, Dr. Shilpa, question to you is, since you have worked in India, where do you see, where is the healthcare sustainability in India? What governments, I have understood that you are closely working with the government. Is government incentivizing the people or the hospitals who are adopting the green building concepts?
Definitely, definitely. I see the world is looking towards the India, and India is going to serve the nation, entire world, that I can see. And because, see, the population is always equal to the potential of the people, right? So population is not always the curse. It's about that how you grow the population. It's about how you create that population more educated, more aware about the system, and how you reach to the grassroots level and bring them up from there. So I think, yeah, pull and push theory. You just pull it, you push it, you get it done. And when you said that motivation, I would like to ask everyone, how are you? How are you all? Hours? All good? Fantastic? Would you like to be every day this fantastic? Yes. So it's a daily question management, right? Daily intelligence. You daily put your efforts to remain good, right? And you have the system around, right? Telemedicine model or the kind of system you have around it. If you remain good every day, if you try to be better for yourself every day, you will not reach to the level. Like on 100, if we have a 24 doctor, how many need a surgery? I would say on 100, we need a 95 wellness experts. So India is having an Ayush. That's a biggest Vardhan, I would say, the India has it, because that is an ancient science which we have. Only the thing is that we are qualifying it, we are making it more research-oriented, we are making it more scientific. We really feel that on 195 people can be served by the Ayush. And this is what we are reaching in our clinic. We are bringing the Ayush, and we are bringing it more qualified people there, because I think when the diseases are more, the qualification also require a little bit to understand it and not to push them in that, sab theek hai. Yeah, we can take care of you. That confidence also has to come from them. So I think India is really doing great. And with the generic medicine, with the Ayush, with our all ancient remedies and all nuske, and definitely we will do the best and we will serve the world.
Okay, excellent. So from mental well-being to health, and now from health to wellness. So one last question to Bruno, to you. I mean, from wellness perspective, what technology can play a role? We understood telemedicine could be there for the treatment, but how technology can enable us to make wellness scalable and to reach the last milestone?
What we have done is, on terms of wellness, is we have done a lot of digitization. So we have given health meters, we have given blood pressure monitors, we have given even, there's a new thing which I'm not promoting Abbott, but they have come with something called a Libre. I tested it on myself. It's a self-monitoring diabetic glucometer, and it keeps on giving you your sugar levels. So I feel so going forward with sustainability, wellness, lifestyle changes, I believe that it all comes down to individual. So each and every one of us should be educated, should be trained. There should be a blood pressure monitor. There should be a glucometer at home. You keep on checking yourself. You go for your walks. You check your HbA1c every 3 months. That's how it works. Prevention is what is going to make it sustainable. And the onus is on each one of us. And we as healthcare providers, we have to educate. It is our responsibility to educate and inform them in a manner that they would embrace with an open heart. They would embrace that, no, this is nothing to get more patients. It is not about that. It is prevention. It is preventing. And that is through technology, AI, wearable devices. I think so, and each and every one should have these at home. I believe so. I have it.
Excellent. So yes, just to conclude this, we would like to say that healthcare sustainability can come with the various points like accessibility, affordability. The major aspect is prevention, networking and collaboration, role of technology like telemedicine, and also the smart gadgets which can help you to monitor your screen. And the most important of all is that it should be within from ourselves. We should be motivated to take care of us, and it should be amongst us. So with that, we will close the session here. Thank you.
Thanks a lot. Thanks a lot. So my question is pretty much basic. I just want to ask ma'am that what age group is more open for this idea of preventive diagnostics?
I would say that the age group is between 22 to 45 is really, they are very much targeted. I have seen them, they are very welcoming, they are understanding. The youth is really taking little time, and the old people, they are not believing it because they are so much used to with the doctors and the medicines. So definitely it's a good question, it's a challenge for us, but I have seen it is very easy between 22 to 45. They just walk in the clinic, they get it done, their vitals check, and they know what to do. So they decide their lifestyle. And I think that works wonderfully. What you said, I agree with you, that vitals is our rights to know. So if you know your vitals.
And as you have also worked in villages, so in comparison to these metro cities, are village people also very much open to the idea of preventive diagnostics?
Believe me, it's not like that. It's they are not that open yet. हम लोग अभी भी है ना वो जो मौका होता है ना वो लेके we go and we meet the sarpanch first. So the process goes like that. When we make the clinic, we meet with the collector. We talk that what the village is all about, what is happening. Then we go to the village. We meet the sarpanch. When the sarpanch tell us that what is the village they have, afternoon they go to sleep. So, you come in the evening or you come in the morning, and evening also between 3:30 to 5:30. So then, we take that and we speak to everybody. They trust us. See, once they trust, believe me, they don't leave us. So it's all about creating the trust in the villages by having the, see, that's why I said that if I am getting the 10 village, I'm going to talk with the children through the experts coming, and mental health experts also will be there. Some institutions will join there. Some sports institution will join there. Some IIM, IITians. IITians are my partner, by the way, in this entire process. So they take care of the data management. So, the entire government project, when I was in COVID, I was working as an officer, I was telling our ministers that if I am a health minister, we were talking, I said, I would say in no time that on my screen, in my district, how many villages are actually needing the doctors, right? And it happens with this kind of telemedicine model and this kind of accessibility to the grassroots level, which makes easier for the doctors also to take care of the patients. So it is easier for the hospitals. There will be no chaos, and management will be fantastic. And believe me, yeah, villages are difficult. It's not that easy. We are working, because we have worked with the Tata on 360 villages in Jawahar, Maharashtra villages. So if you go just ahead of Thane, you will see the reality. So, you will see that they are very much with the orthodox treatments. They still do the very orthodox treatment, non-medical treatment. They see Google, but if you understand, everybody has a mobile, but what they see in Google, which is more entertaining. They are not aware about the knowledge taking from the Google or how to use it. So even we have the people who use them. So the youngsters over there, I believe me, doctor, that we involve them and we tell them, teach them what they should see in Google. Believe me, these are very small thing, but this makes hell of a difference to them. So this is the way, we try to work on ecosystem in a very, very small manners.
Thank you. Just small question. Just Bruno sir told that preventive medicine is the key to make things sustainable, and many a times these preventive steps are technologically also advanced. So since we have global leaders over here, so to make things sustainable, how governments are open? For example, if I say pharmacogenomics, which is genomically driven precision medicine. So how governments are open to collaborate and make this thing sustainable, or the preventive thing sustainable? Yes.
Because DNA, she's talking about the DNA when we are talking about the genomics, right?
Yes, yes.
Okay, I work with the, as a longevity, I think Dr. Rachna must have spoken about the gene, anti-aging gene, right? So DNA is definitely a very progressive structure, because once you get it done, your swab test, you are into prevention. I'm
Yes,
getting it
yes.
from where it is coming.
Yes, yes,
So,
yes.
but you know, if you want to check the DNA, the centrifugation is so expensive, because you need 100 tests at a time to run on that. So to make it sustainable, you need to have the people. Okay, I'll ask the question, audience are over here only. How many of you know about the DNA anti-aging test or preventive test? Believe me, DNA is amazing thing which she has brought up over here, because we think that it's not reachable. We are talking only about the affordable, but this is also an affordable system
Yes.
which can bring it up in the notice of it. Thank you so much for asking this. So how much of you are actually would like to go for DNA test for the prevention? How many of you are? Believe me, be very open. Don't be orthodox in your thinking that mera DNA test ho raha hai. We all are educated over here. Oh, you got it done. I have got it done. We have done it for the soccer players and we have given result to them. So these are not something what is, how authentic DNA test is. You just have to do once, but you have to done it from the authentic people. You should have to done it from the best one. And you can give the results. Amazing. I have a lot of case studies on that. Ma'am, we can definitely work on this. This is something very nice. I would love to, I would like to take it.